Hello, my name is Jan Mold. I'm Deputy Director of Competitive Events for Hosts of Future Health Professionals, and today I'm going to be talking about medical errors. A 2016 study that was conducted by Johns Hopkins said that medical errors are now the third leading cause of death in the United States. That was really surprising to me. They went on to say that the CDC does not classify medical errors separately on death certificates. So that number that they used to decide it was the third leading cause of death is probably a great deal higher. So let's talk about what are some of the common causes of medical errors. One is communication problems. It is the number one cause of medical errors. It could be verbal, written. It doesn't matter if it's between a physician, nurse, healthcare team member, or patient. Poor communication is a problem. Inadequate information in a healthcare setting is that you're not only going to be working with the patient, but you're also going to be working with a number of services. So a flow of information from service to service is really important. Human problems come in when there's poor documentation, there's knowledge-based errors. There's also things like not following the policy and procedures. Patient-related issues could have to do with patient identification, an inadequate patient assessment, a failure to obtain consent, or a failure just to educate that patient. Organizational transfer knowledge is when we are having a patient transferred from one part of the hospital to another, or they're leaving, being discharged to another facility or to home. There can be a real problem with not sharing adequate information at that time. The more stressed the staff is, the more inadequate staffing is, the more likely for medical errors. Technical failures can be complications of medical devices, implants, pieces of equipment. And then inadequate policy is often failure to have documented or have adequate policies and procedures in place to be followed. So all 8 of those are common medical errors. I want to share a video clip with you called To Err is Human. This is a documentary that has been released.
Both my husband, Pat, and my son, Cal, experienced diagnostic errors. Cal suffered brain damage from his newborn jaundice when it was misdiagnosed. Today he has significant cerebral palsy. And Pat, my husband, died when he was 45 from a cancer that was appropriately diagnosed, but the pathology failed to get communicated to the doctor or Pat. It was hard for us to understand and believe that this could happen in a developed country like the United States.
Look at many of the statistics as the third leading cause of death in the U.S. Most people are completely unaware of that.
That is the equivalent of 7 or 8 airliners crashing every day with no survivors.
We're probably filling one Arlington cemetery every year from preventable medical harm.
Most of us in medicine just say, well, that's the way it is.
This is a problem that's, hiding in plain sight.
It's urgent. It's a public health emergency.
If you believe first do no harm, there is no excuse for not investing in things which will prevent harm.
We have to acknowledge that to err is human, and then to figure out what do we do with that fact in terms of building a system that's safe for patients.
We got to change it. We got to make it better. And I think many people are working very hard to make it better.
One of the ways to really make a difference is you've got to get patients engaged.
We could prevent many of these deaths immediately if we just put in the effort.
We need to think about them not as unavoidable, but as unthinkable.
To change patient safety or to change everything.
We built it completely wrong. This is a time for openness and honesty. It's not any
These are not just things that happen to other people. They happen to us, they happen to our families, and they are things that we need to work on.
I cannot change what happened to Cal and Pat. However, my family story is also a story of awakening, of passion, of change, and hope for the future.
Kind of makes you stop and think a little bit, which is exactly what we need to do about this topic. Because that was 2019 when that documentary was released, and there's been a little bit of change in focus. You heard in the documentary that they were saying that we need to change the system. And that was a lot of the focus, and there's a lot of things that came out of that, but there's also been a little bit of a change in the climate on this, and so I'm going to ask you to research a medical error case that resulted in legal charges. As you think about that, we have gone, in that particular case, if charges are brought, we've gone from not a system issue, but more of an individual issue. And that brings us to what you'll be doing with that information after you research it. The question that you'll be responding to is, should medical errors be considered criminal offenses? So you're going to select your position on that question. Either yes, you think that is appropriate, or no, you don't. You're going to write a 5-paragraph persuasive essay defending or swaying others to your position. So you decide which way you're going to take a stand on this, and then you're going to try to convince others to go with you. After you've done that, you will have completed the first step in the biomedical debate event for 22-23, because the topic this year, and I'm going to take you to the guidelines, the topic this year is the exact question: medical errors should be considered criminal offenses. Remember, this is a 4-member team event. It's 3 to 4 people. You don't know which side of the topic you'll get, so you have to research both. But one of the things I'll tell you is that good debaters know exactly what the other side's going to say, so that's to your advantage. So we hope to see some of you participating in the biomedical debate event in Dallas this summer. Thank you for your time.